episode of Dr. Phinney's Let's Talk About It. And today we're going to be talking about depression in childhood. This is a very difficult topic because, as a parent, or if you're a parent or you have young children that you're involved with, you might know a little bit about depression. Now, children are quite different from adults, as we all know. They do present with some of the symptoms that adults present with in depression. When a child is depressed, they might feel sad. They might actually tell you that they feel sad. They might be more irritable. They might show anger outbursts. They might act out as well. Their sleep might be disturbed at times. The problem with depression in childhood is in a severe form, children can start having suicidal thoughts, and children are a lot more impulsive than adults are. Now, boys and girls, they have suicidal thoughts when they're very depressed. Boys also have suicidal thoughts when they're very depressed. But the only difference is girls are more often going to attempt suicide, but boys are more often going to actually attempt and kill themselves. So basically, boys would follow through. So this is why we need to be very careful with depression in children. In depression in children, we might see a deterioration in their, academics. They might be more socially withdrawn. They might start to, behave badly at home. They might be difficult within the family. And the effect on the family can be tremendous at times. If there are other siblings there, they could affect them quite a bit. And what happens is if these children are not quickly assessed, diagnosed, and treated, they actually get worse. A lot of times parents want to deny that their kids are depressed. It's not easy. You might feel as a parent you haven't done enough for your child, but anybody can develop depression. Any child can develop depression. But certain children are probably more prone. For example, if there is a family history of depression, if the home environment is chaotic, if there are incidents of violence within the home, physical, sexual abuse, children can internalize a lot. And of course, this is where, the teachers, the school, this is where they come in. Because a lot of the time, some of these symptoms can also be picked up within the school environment. For instance, a child who was performing really well in school before suddenly starts to neglect his or her schoolwork, suddenly starts to deteriorate, doesn't want to go to school, starts to truant as well. Some of these symptoms need to be taken seriously because they could all be pointers to depression. So what do you do if you think your child is depressed? Or what do you do as a teacher if you think one of your students or pupils is depressed? Well, the first thing you need to do is to make sure you take the child to be assessed by a mental health professional. And this does not necessarily have to be a doctor. It could be a nurse or anybody who works in the mental health field. The key is to get that early intervention as soon as possible. And once a child has been assessed, diagnosed, then treatment can commence. Now, in children, we try really hard to avoid medication. So normally we would start with psychological intervention. And usually this is in the form of cognitive behavioral therapy. So in a nutshell, what is CBT? Cognitive behavioral therapy, CBT for short. CBT is an intervention that we use to try and change the negative thoughts that we have, change them into positive thoughts. So basically replacing those negative thoughts with positive thoughts, and in the process helping to change the way the person thinks and eventually changing the person's behavior and giving them the ability to cope more with stress. CBT is used in adults as well, not just in children, but in depression in children, we always prefer to start with psychological therapies. Also, we might consider family therapy. The family unit is very important in treatment of children with depression. So family therapy involves the family members. Of course, there are different kinds of families today, and before there have always been different kinds of families. But as much as possible, you want to involve the family in family therapy. It does make a huge difference to a child when they're aware that their whole family is involved in their treatment. So after psychological intervention, if this fails, you have to look at the environment of the child. And of course, if psychological intervention is not successful, there's always the option of medication. We don't like to prescribe medication for children, and there is only one medication licensed for depression in children. And this is something that your doctor can assess and ensure that if it's appropriate for the child is started on a nice small dose. And if that dose is not effective, obviously this can be assessed again and increased gradually. So for children, there's only one licensed drug that we use for depression. And this is normally prescribed at the lowest effective dose and gradually increased depending on the response of a child. So for most children, you will start seeing a response within a few weeks, and side effects are there, but they're minimum and they need to be monitored again by the doctor. A combination of medication and psychological intervention has been shown to be more effective than either of them. As much as we want psychological intervention, it's not always effective alone as a form of treatment. So what else can we do for a child who's depressed? You need to support that child as much as possible. Make sure that they know that they're not alone. Make sure that they feel, the support of friends, of families, of the teachers especially. Don't give them time to self-isolate, because when they start self-isolating, that is a major problem. Support is the most important factor when somebody has depression. And as I said, in its worst forms, they start to experience suicidal thoughts. We spoke about suicide in one of our previous episodes, so please have a listen to that episode. And all the support networks out there, I will put them here again in this particular episode. And please contact me if you have any questions. Contact me on my Facebook account, my Twitter account, or my YouTube channel as well. Keep thinking, keep staying positive. Mental health is real, but together we will fight the stigma. Thank you so much for watching Dr. Phinney's Let's Talk About It.